Hi everyone, this is Dr. Merhaut with Elite Sports and Spine Chiropractic. Welcome to this week's Elite Education Series. We're going to be talking about headaches. I picked 3 different types of headaches. There are more than 10 different types of headaches total, but we're going to go over 3 of them, some of the most common ones that we'll typically see in the office. Those are migraine headaches, tension headaches, and sinus headaches. So there are multiple other styles of headaches and types of headaches that we won't go over today, but these are just a couple that we see typically in the office. Before I go into the headaches, I do also want to mention we are still doing our New Year, New You health seminar this Saturday at 10:30. There are still spots open, so if you're interested, please feel free to sign up. There's information that is posted on our Facebook page as well as our Instagram page that you can see to sign up for that. So with headaches, let's start with migraine headaches. A lot of people come in the office saying that they have migraine headaches, and that may or may not be the case when we do the evaluation. So typically with a migraine headache, it'll be usually one-sided. It's also most common in females. About 75% of people that have migraine headaches are female patients. The migraine headache typically starts somewhere around the eye, forehead, temple region. It can come on quickly. It can last anywhere from a couple minutes to a couple days. This can be an ongoing thing. It can be something that just happens a couple times throughout your lifetime, but more often than not, it's something that is chronic and occurs over and over again throughout someone's life. With migraine headaches, they tend to be sensitive to light or sounds. So people, when if someone's experienced a headache and they're saying, I need to have the lights turned off and I just need to go lie down in a quiet room until it passes, that's typically what we'll hear when there's a migraine headache involved. Sometimes people have them so severe that they'll even get nauseous and want to throw up, or just feel sick and nauseated. Next type of headache that we'll move on to is the tension headache. This is something I see almost every single day with the tension headaches. Oftentimes there's a combination between one headache and another. You may have 2 or 3 different types of headaches that are kind of building on top of each other, but the tension headache is a headache that is formed from muscle tension, hence the name. So a lot of the tension is built up through the shoulders. If you hear people say that they hold a lot of their stress in their shoulders, they can develop that tension headache through the upper traps. The upper traps start back here and then they go all the way up and attach to the base of the head, base of the skull. So if people complain about their headache either starting up here and then traveling upward, or starting back here and then also kind of radiating towards the front, that can be an indication that it's a tension headache. Some people describe their tension headaches as someone has a band around their head right through here and it's just crushing their skull. That can be what a tension headache feels like. It can feel like pressure back here, pressure on the sides, or pressure in the front. Most of the time you're going to have it on both sides. One side may be worse than the other, but it's common to have a tension headache on both sides. Some people that have that pressure up here, that can be related to a tension headache because the muscles in the back can be tense and then pull everything from here all the way back, and you can experience that headache up in the front or on the sides. And like I also said, also in the back. You have small tiny muscles in the back of the head that help with fine motor movements of the head. Those are your suboccipital muscles, so those little guys back here can also be really tense and be the cause of some of the tension type headaches people experience. Those can also be acute, where you get them just once or twice throughout your lifetime, or it can be more so chronic or episodic, where you're having them consistently over and over again. And that can be due to posture. We talked about upper cross in one of these Elite Education series. So if you're having a forward rolled shoulder, you're constantly at a desk, your head's jutted forward too, that's putting stress and tension on those areas, and then those can lead to the tension type headaches. The third one that we'll talk about today is sinus type headaches, sinus pressure. So this can present similarly to the tension type headaches. So a lot of people will have pressure or pain, or their headache starts right here, or even right here. These are 2 common areas where there are sinuses within the skull. The sinuses are just air pockets within the bones themselves in the skull, and then those can fill up with mucus and fluid. If someone has an allergy to something or their sinuses are inflamed, the lining of the sinuses can be inflamed and cause pressure within there, as well as you can have fluid build up within those sinuses themselves. So you can have one side feeling more the sinus fluid. As you probably know from just if you're lying down and you have a sinus headache, it can kind of switch from one side to the other. That's just based on the fluid moving from one side to another and draining. There are oftentimes it's very tender to touch in those areas when you're having a sinus type headache. So there are many different things that can be done for these types of headaches: migraine, tension, sinus type headaches. We treat those. People that come in the office have those types of things, and we try to help them with reducing the intensity of those, reducing the frequency of those types of headaches, as well as other types of headaches that come in the office that I didn't mention today. Like I said, there's more than 10 different types of headaches that you can have with that. One other thing that I'll mention that can be associated with the migraine, even sinus type headaches, is food sensitivities and food allergies. That is also going along with the health seminar that we're doing this weekend. So if you're possibly experiencing some type of headache, we have people all the time that go through this cleanse process that is also going to be introduced through this health seminar. And a lot of their headaches decrease in frequency, decrease in intensity. Some people, they even go away completely. So there may be a potential food sensitivity or something that's connecting the headache to the gut, and that kind of thing. We can go over and answer those types of questions at the seminar if you want to participate in that. So this is the Elite Education Series. I'm Dr. Merhaut. I hope you